Hi, my name is Dr. Vas, and today we're going to discuss achalasia and neuronal linkage. What is achalasia? Achalasia is an esophageal motility disorder caused by impaired relaxation of LES lower esophageal sphincter. Key symptoms: progressive dysphagia to solid and liquids, regurgitation, chest discomfort, weight loss, and nocturnal cough or aspiration. Core concept: food cannot pass normally into the stomach because LES stays abnormally tight. That is the image showing the normal peristalsis lost, failure to LES relaxation, food stasis, and esophageal dilation. That is the mechanism. The image showing the mechanism of achalasia. These are the key mechanistic points. The lower esophageal sphincter fails to relax appropriately during the swelling. Normal coordinated peristalsis in esophageal body is lost. Food and fluid accumulate in esophagus, produce stasis and progressive dilation. Long-standing disease may lead to tortuosity and megaesophagus. That is the consequences: dysphagia, regurgitation, chest pain, aspiration, and weight loss. Nervous system play a key role in achalasia. Normal swelling requires coordinated esophageal peristalsis, and peristalsis, as you all know, comprises of the contraction and relaxation at the uh, uh, alternate time, or alternatively, they can contract and relax. The coordination is controlled mainly by enteric nervous system. Inhibitory Myenteric neurons are selectively damaged or lost. Reduced inhibitory signaling produce peristalsis, tight LES, food stasis, and esophageal dilation. That is the image showing achalasia and inhibitory neuronal failure at the distal esophagus and LES. That is the normal neuronal control of swelling. Swelling signal Myenteric plexus get activated, coordinated peristalsis, and LES relaxation. That is the excitatory arm. Then comes the inhibitory arm. Then comes the normal outcome of both excitatory and inhibitory. That is the mechanism: neuronal failure, inflammation, loss of inhibitory neurons, decrease NO and decrease VIP relaxation signals, unopposed cholinergic contractile activity, incomplete LES relaxation plus peristalsis, food stasis and dilation might happen in patient. The key line: achalasia is primarily disorder of inhibitory enteric neurotransmission rather than a primary muscle disease. Neurotransmitter imbalance in achalasia: normal balance ACH contraction is balanced by NO and VIP relaxation. In achalasia, imbalance of NO VIP falls, cholinergic tone dominates. That is the normal mechanism. That is when the disease get happen in patients. That show the normal LES. Achalasia LES does not relax properly, remain functionally obstructive. Clinical effect: dysphagia to solid and liquids, regurgitation, and chest discomfort. Vagus nerve and enteric nervous system linkage: brainstem, vagus nerve, Myenteric plexus, and LES response. That is the central control for the swelling and vagal pathways. that is the local and direct control by the LES peristaltic movements, VIP and NO, and in achalasia, central swelling input may arrive, but damaged inhibitory and direct nerve network cannot produce proper LES relaxation. That is the diagnosis. Dysphagia, regurgitation, chest pain, weight loss. Evaluate for achalasia. Try of test, confirm diagnosis, and exclude mechanical obstruction. For the diagnosis, different tests uh, applied for the diagnosis of the uh, achalasia, like barium swelling, upper endoscopy, esophageal manometry, and high resolution manometry, also classified achalasia types 1, 2, 3, which can influence therapy. That is the treatment: pneumatic dilation, botulinum toxin injection, laparoscopic myotomy, and POEM per oral endoscopic myotomy. And that comes the last but not least, the drugs, especially calcium channel blocker. The treatment goal should be clear: relieve dysphagia, improve nutrition, reduce stasis, and prevent complications. That is the summary: normal swelling, neuronal injury, transmitter loss, functional obstruction, disease expression. Concise sideline: achalasia is neurogenic motility disorder caused by loss of inhibitory indirect neuron, leading to impaired LES relaxation and absent peristalsis. Thanks and regards. Please like and subscribe this channel. Thanks.